Veterinary endoscope application. Hugemed VBR-M21, the world's first flexible endoscope with an outer diameter of 2.1 mm and a working channel of 1.2 mm. It can provide the unparalleled access needed for comprehensive diagnostics in small cats and dogs, birds, lagomorphs, rodents, and reptiles, from upper GI and respiratory tracts to urogenital examinations. Clinical procedure sharing. Case 1. The patient is a spayed female cat, weighing 5 kilograms, suffering from ureteral stones and bladder stones. The surgery used a Hugemed VBR-M21 endoscope, combined with laser lithotripsy. The doctor can choose the surgical method based on the pet's breed, weight, neuter status, and gender. In this case, a sheathless technique was used for urinary stone surgery in the cat, with excellent results. 1. Endoscope introduction. The tip of the lubricated flexible endoscope is gently introduced into the urethral opening and advanced under direct visual guidance through the urethra and into the bladder lumen. The procedure is performed under complete video visualization. 2. Bladder examination cystoscopy. A systematic examination of the bladder is performed. The mucosa is assessed for hyperemia, edema, hemorrhage, or masses. The number, size, location, and approximate composition based on visual appearance. For example, calcium oxalate stones are often dark and jagged. Struvite stones may be lighter and smoother. Of the uroliths are documented. 3. Laser fiber positioning. Under endoscopic guidance, the laser fiber is advanced through the instrument channel until it protrudes 1 to 2 mm beyond the scope's tip. The fiber tip is positioned perpendicular to and in direct contact with or 1 mm from the surface of the stone. 4. Lithotripsy stone fragmentation. The laser is activated using the foot pedal in short, deliberate pulses. The surgeon methodically moves the fiber across the surface of the stone, painting it to break it into small, sand-like particles 1 mm. The popcorn technique may be used, where the fiber is held just off the stone in a field of fragments, causing them to bounce and fragment further upon laser impact. Key safety principle: the fiber tip must always be in clear view and directed away from the bladder wall to prevent perforation or thermal damage to the mucosa. 5. Irrigation and fragment removal. Continuous irrigation flushes the field. Larger fragments can be retrieved with endoscopic baskets or graspers if necessary. The primary goal is to fragment stones into particles small enough to be voided naturally during urination. 6. Post-fragmentation examination. After all visible stones are fragmented, the bladder is thoroughly re-examined to ensure no large fragments remain, particularly in the dome of the bladder or near the ureteral openings, preventing possible ureteral obstruction. 7. Termination. The laser fiber is carefully retracted back into the instrument channel before the scope is withdrawn to prevent damage to the urethra. The endoscope is gently removed. Case 2. The patient is a spayed male dog, weighing 7 kilograms, suffering from ureteral stones and bladder stones. The surgery used a Hugemed VBR-M21 endoscope combined with the stone retrieval basket. The surgical procedure used was cistotomy. 1. Insertion of the sheath. Following a series of preoperative preparations, a small incision is made in the abdominal wall overlying the bladder using a surgical blade. A sheath is inserted retrogradely into the urethra. 2. Insert the endoscope. The Hugemed VBR-M21 endoscope is advanced through the sheath into the bladder. It examines the bladder interior to assess the mucosa for signs of inflammation, bleeding, or tumors. At this stage, the full HD imaging delivers exceptionally clear visuals, aiding veterinarians in real-time diagnosis of intravesical conditions. The angulation control level control insert tube up to 285 bending angle helps to inspect every corner and reduces blind spots. 3. Inserting the stone retrieval basket. The stone basket is advanced through the 1.2 mm working channel of the Hugemed VBR M21 endoscope into the bladder. Case 3. The patient is a cat weighing 4.5 kilograms, suffering from an unexplained cough. In the clinical treatment of cats, flexible endoscopes with an outer diameter typically 3/8 mm are generally recommended. The endoscope used in this case is Hugemed VBR M21, the world's first flexible endoscope with an outer diameter of 2.1 mm and a working channel of 1.2 mm. Such a thin insertion tube reduces damage to the cat's trachea and allows access to deeper parts of the lungs. 1. Insertion of the ET and the endoscope. Position the cat in sternal or lateral recumbency with the neck extended. The bronchoscope is lightly lubricated and passed through the lumen of the ET. 2. Wedging. Gently advance the scope until it is wedged in a small bronchus, typically in a caudal lung lobe or the area of greatest pathology. 3. Installation and aspiration. Pre-warmed. Sterile saline is instilled through the biopsy channel of the scope. A typical volume is 1-2 ml per kilogram, divided into 2-3 aliquots. Then immediately after installation. 4. Sample collection. The retrieved fluid is submitted for cytology and microbial culture and sensitivity. Case 4. Pre-procedural assessment. A 24 kilograms male dog presented with dysuria and gross hematuria. Diagnostic imaging confirmed some distinct uroliths within the penile and/or proximal urethra. Procedure description. Basket deployment. A 1.9 French for stone retrieval basket was advanced through the working channel of the endoscope and maneuvered past the target stone under direct visualization. Engagement and retrieval. The basket was opened distal to the stone, gently withdrawn to engage the stone within the basket wires. The basket was then carefully closed, securely entrapping the stone. Under continuous visualization, the basket, stone, and endoscope were withdrawn together as a single unit through the urethra and out the penile orifice. Result: one small, smooth stone was successfully retrieved intact.